Good morning, everyone. I'd like to take a moment and just welcome each and every one of you here. Please note that this session is being recorded. If you do not consent to being recorded, you are asked to drop off the session at this time. Good morning, everyone. Again, my name is Nicholas Lewis. I'm the secretary for the Lummi Nation in Washington State, and I'm the National Indian Health Board vice chairperson and the chairman of the Northwest Portland Area Indian Health Board. It is my pleasure to welcome you to the National Indian Health Board's Don't Miss Your Shot COVID-19 Youth Summit. Before we begin today, I'd like to take a moment and start us off with an opening prayer. And I'd like to ask if we can ask Dr. Allison Kelliher to say an opening prayer for us. If that's okay, Doctor?
Gahatne, Anabasi, Anamasi. Hello, everyone. I'm so honored to share with you this prayer. Please join me. Creator God, Danahato, Divine Mother, we ask for a special blessing today for all of us who are joined on Grandmother's Spiderweb, and that you will extend your blessings to our families, loved ones, and communities. We ask for a special prayer today for those of us that are doing the work of science and caring for each other, that our healthcare workers and providers are lifted up, and that our communities, especially those who are suffering from illness, are healed through the balance of mind, body, and spirit. We ask that you infuse us with grace and honor and gratitude, for it is such an honor to join this group today at the National Indian Health Board, and we thank you for all those blessings, especially our plant brothers and sisters, our four-legged brothers and sisters, those who live in and fly in the sky, our winged brothers and sisters, and a special gratitude for our earth and our waters as we continue to work together to protect our brothers and sisters. Thank you so much for joining us. Kuyana Anabasi Anamasi. Amen. I believe you're muted, Nicholas.
Thank you. Thank you for starting us off with the words and the teachings of your ancestors, and just keeping us all grounded in the way you did. So thank you for that. The COVID-19 vaccine plays an important role in protecting our tribal communities. Over the past few months, the FDA has issued an emergency use authorization allowing children as young as 5 years old to receive their vaccination. Native youth across the country are getting COVID-19 vaccines for various reasons: going back to school, playing sports, protecting their family and their communities. And it is crucial that tribal citizens from the youngest to the oldest are protected. One way to do this is by getting vaccinated, if eligible. Today, we are focusing on vaccinating youth and addressing the misinformation about COVID-19 vaccinations. The first session of the summit will focus on the Delta variant and why it is important to get vaccinated. We are joined by Dr. Allison Kelliher, Director of the American Indian Collaborative Research Network, an assistant professor, clinician, scholar department of family medicine and community medicine and population health. Before we get started, I have a few housekeeping notes. As I mentioned earlier, the session is being recorded and will be available for viewing on the National Indian Health Board YouTube channel in the coming days. The presenter's PowerPoint presentation will be available for download in a few days on the National Indian Health Board website. The live transcript has been enabled for the summit. And if you wish to hide the live transcript, you may click on the live transcript button, then the hide subtitle. All participants have been muted. Please leave yourself on mute unless the presenter specifically asks you to unmute and engage with the conversation. If you have any questions for the presenter, please use the chat feature in the Zoom webinar. We will hold most questions until the end of the session, and then I will read questions aloud for the presenter to answer during the Q&A at the end of the presentation and as time permits. If you have any technical questions, please reach out to Darby Gallagher or Courtney Wheeler via the chat function. Thank you once again for your participation. And now let's welcome our presenter, Dr. Allison Kelliher. Dr. Allison Kelliher is said to be the first, I apologize, Doctor, can you say that word, Koyokun?
Koyukon Athabaskan.
Okay. Physician. Her family carries a tradition of healing, and she is the only medical trained as a tribal doctor in Alaska's health system. That is a very impressive thing. From Nome, Alaska, she has built her own practice, allowing for her to utilize her training as a family doctor, board certified in intergenerative and holistic medicine. She has a background in biomedical research and received her BS in Indigenous Medicine from the University of Alaska Fairbanks in 2001. Dr. Kelliher graduated from the University of Washington School of Medicine in 2005 and the Alaska Family Medicine Residency in 2009. She has served on the AMA Minority Affairs Commission, created an acupuncture program for primary care while working for the IHS in Sells, Arizona, and teaches and mentors medical students and residents in facilities in the University of Alaska in Anchorage. Her chapter was recently published in the textbook, Wisdom Traditions, Working Together for Community Well-Being. I'd like to now turn the floor over to you, Doctor. Thank you.
Thank you so much. It's such an honor to join you all today. I really appreciate the invitation and opportunity to speak with you about such an important topic as COVID-19 vaccines and addressing questions around that. I'm currently speaking to you from Grand Forks, North Dakota, where I work at the University of North Dakota. And I'd like to share my slideshow presentation so we can share together on a visual experience. Happy Native American Heritage Month, everyone. It's an honor that we can come together during this time. I would like to share a little bit about my story and my personal journey, and that is a very relevant way that we as Indigenous people and also as traditional healers share information, but storytelling is also a way that we can heal and weave a story of our own betterment and how we find meaning and health over time. I want to talk about the science of COVID-19, particularly reviewing that science is knowledge around the natural world that is based on facts, learned through experiments and observation. And our ancestors have been masters of science, learning how to live with our environment and with all of our brothers and sisters here on our beautiful planet. We'll take a look at COVID-19, a little bit about its history and some of the different variants, particularly the Delta variant, and then move on into vaccines. I follow my mother's clan line. We're called Koyukon Athabaskan in books, but we call ourselves Dene. We share a language group with other tribes, such as the Navajo and Apache, and other groups, especially throughout Canada. My name is Minoya Dlekan, the bringer of the sun and the bringer of the moon, and I'm from the King Salmon, or resiliency clan. And so that's the water clan. Shege Hutana Etzlan, Tunitiketzit Te Hutana Etzlan. We come from Nalahado or Nalado. And I was thinking that it's important to share that in my clan and family history, we come from a real remote part of Alaska, a remote place. And about 100 years ago, when we had the 1918 pandemic, we were really affected by it. So we only had 3 families that survived from that time. And even though that's a really sad and difficult thing for me, that took me 40 years to learn about my family history, I just wanted to share that that's part of the reason that we as Native people really, I think it's important that we talk about vaccines and health because we've been through a lot as Native peoples. Some people during that time and some communities really guarded their villages, and we rely on our families and communities so that we can thrive as people and as our villages and tribes. You can see a picture of my mom hunting crane before she went to boarding school. And also, I wanted to say that I was born during what my parents say was the coldest month and the coldest Iditarod sled dog race. So that's at 1,000-mile race that ends in my hometown of Nome, Alaska. And that race started to bring medicine or serum to people who had real bad sore throats, diphtheria. And so you can see a picture of my dad in the dog sled basket in the lower picture with his siblings and his mom there. So people have lived with viruses and illnesses for a long time, and we've always worked to help each other and to work towards health together. You can see where my tribe, the Koyukon or Dene people are. We're in that salmon orangish colored area at the center of this image. And then oftentimes we describe Alaska as a profile of a face. So my hometown is right on the bottom part of the nose. You can also see there's a little tiny map that has the red color that explains the where our language groups are and how much we have in common as far as our language across even North America. Here's a picture of Nome from the air, and you can see it's kind of a remote place. We're not connected to other communities by roads. So it's really something where we have to fly in. We used to walk in, and that just gives us an idea of how self-reliant we have to be. I want to remind us that we're all here because of the power of our ancestors, them being successful and innovative, strong, smart, and capable. You can see my great grandmother, Agnes, who was our medicine woman up on the left, and my grandmother, Mary Margaret, who was trained as a nurse, as well as my mother's family in the village of Nalahado there. And my grandparents, my Irish grandparents, and their beautiful wedding picture there, just reminding us that our ancestors have done good advocacy and have helped us to be here today. So how about this idea of COVID-19? Well, it's hard, I think, to understand what a virus is. For me, I learned about it in college and medical school, but basically it's information surrounded by a coat, and that coat is a protein coat. And I think of it as kind of a lunar landing module. It's a tiny microscopic packet of information that can inject its information or transfer its information into our cells. And I have another picture of that in a minute. There's lots of different types of viruses, such as influenza, and there's different types of coronaviruses. The most common type before COVID-19 was the cold virus. And there are lots of different strains of COVID-19, and this Delta variant that is the most common right now is a strong virus that's much easier to spread than the original COVID-19. This illness, the COVID-19, can cause lots of different symptoms, and some people don't even have symptoms at all. And we can't predict right now who's going to get sick from the COVID-19 or who's maybe just going to not have symptoms but could still spread it even if they don't have symptoms. But we do know that older people, our elders, or people who have um, other illnesses such as diabetes or high blood pressure are at risk for getting more sick. And because we're so interreliant on our families and communities, we really need to consider that and think about the health of our communities. Here's a picture that reminds us of that lunar landing module and how that COVID-19 virus can come into contact with our cells and then use our machines, our tiny microscopic machines inside of our cells to replicate itself. So it kind of takes over our cells to make more of its same information and kind of trying to spread its own information. But when we have vaccines or when we have infections, we can produce these Y-shaped proteins that stick to viruses and bacteria and can prevent us from getting sick. So it looks like um, it looks like vaccines can help up to decreasing our odds of getting sick by at least 5 times, so that you're much less likely to get ill if you have a vaccine. And the vaccines originally, before Delta came out, were really super effective. Now there's, by some studies, a 1 in 100 chance that if you're vaccinated, that you could still feel sick from the COVID-19. So this schematic shows that the original COVID-19 would maybe spread to a couple people, but with the Delta variant, it's a lot more effective at sticking to our cells and getting into our bodies, especially inside the nose. And so we see that it spreads more like to 5 people instead of just to 2. Some symptoms include runny nose, and I think it's important to mention that because people that are vaccinated, they sometimes can still feel a little bit of runny nose, and that's the most common symptom that they have. But vaccines would prevent a lot of these other symptoms, such as fever or worse cough with difficulty breathing. We know some people have a loss of taste or smell that tends to go away after a few weeks. And some people can also have stomach and gut complaints, such as nausea or vomiting or diarrhea. People can get real sick from the COVID, and that includes things like trouble breathing, chest pain, or confusion, or color changes in the skin, which would be more of an emergency and would require us to seek a higher level of care and get care from a healthcare provider. So this is just a reminder that according to experts, it's really important to get vaccinated in addition to maintaining physical distance, wearing our masks, and using good sanitation such as hand washing. And I just want to remind us that some of our communities don't even have good access to water. So it's really important that we work together to help prevent this spread, even by getting vaccinated. So we don't know how long we could be immune to COVID-19 if we get the wild type virus. So when I got COVID-19 in March of 2020, my immunity to it wore off after a few months. So that's how come I also got vaccinated, is so that I could have more immunity because the vaccine immunity lasts longer. I think it's important to acknowledge that Alaska Native and American Indian people tend to get sicker from COVID-19. And part of that is because we live in houses with lots of generations. So it's not just us in our homes. Sometimes it's our children, nieces, nephews, parents, grandparents, that kind of thing. And we can live in smaller homes as well. And there's other things such as having higher rates of diabetes that can lead to us getting worse COVID. So there's pictures of my aunties and my cousin, and all of us are vaccinated. And that's us at ceremony a couple years ago. And this is just an example of our cabin in about 10 miles outside of Nome up north. And so I'm the fifth out of six children, and all six of us kids and my parents lived in this cabin. So you can see how infections might spread in a smaller place easier than if we lived in like a 4-bedroom home, right? So that's part of what we should consider as Native people. This is a graph from Morbidity and Mortality Weekly, which is a very great source of information. It's very reliable, and great scientists work on this, and epidemiologists, smart scientists who know about medicine. And they're showing us here in this picture that in the light blue, American Indian and Alaska Native folks unfortunately suffer more deaths than people who are identified as white, especially at younger ages. So this is really important for us to keep in mind, that younger people who are Indigenous tend to get sicker or more sick. And that's why it's really important for us also to get vaccinated, is for our own health. And also because it's less likely for us to spread the disease to others. So vaccines have been used for a long time to prevent diseases that can be dangerous or deadly. And I have a little picture of polio, mumps, tetanus, and other types of vaccines that have been used for a long time. And all vaccines help our immune system to make those Y-shaped protein antibodies that make that infectious virus neutralized so that it can't infect us. So unlike most medicines which treat or cure disease, vaccines actually prevent disease. There are 3 vaccines: the Pfizer, the Moderna, and the Johnson & Johnson vaccine, and all have been deemed to be safe and highly effective against preventing serious illness, particularly hospitalization and death. And the Pfizer vaccine is what has been authorized to be used in younger people aged 5 and up. The Pfizer vaccine is a 2-dose series, as is the Moderna vaccine, whereas the Johnson & Johnson vaccine is just a 1 vaccine. And here's a graph showing that under 4 years old, we're not recommending vaccines right now, but between 5 years and up, we can recommend the Pfizer BioNTech vaccine. And we're waiting to hear if we'll allow the other vaccines when the studies come in and show their safety in younger people. So the vaccines keep us from getting sick, protect others from getting sick, and then also keep in mind that the more people that are vaccinated, hopefully we can prevent the tremendous spread of COVID-19. So right now in Minnesota, very nearby North Dakota, we have 3 times the COVID-19 rates, and really are we have really high rates of COVID, and that's a problem because there's only so much room in the hospitals. So it would be much better if we had vaccines so that folks didn't get as sick, and we had enough rooms in the hospitals to take care of people who are sick. Just a reminder here that COVID-19 vaccines don't actually give you COVID-19. They help you to be immune to COVID-19. And also these vaccines don't cause you to be positive for a COVID-19 test. There's been lots of studies that show the safety of these vaccines, and these studies have been looked at by lots of processes and organizations that are really reliable. And that includes the Food and Drug Administration, as well as the Centers for Disease Control, as well as we have vaccine monitoring, including vSafe through VAERS. And I'll tell you a little bit more about that. So how do vaccine trials start? Well, we have small groups, and then we tend to study different groups. And then also we study tens of thousands, so lots and lots of people, to research the safety and effectiveness. So whether the vaccines are safe and whether they in fact protect us. And the Advisory Committee on Immunization Practices, the AAIP, does an extensive review and is also an independent process that looks at the data and information. So it's multiple different organizations making sure that we check the data and that the information and the science is correct and true. There are some side effects from the vaccine. So for me, I got tiredness and headache, but some people can have pain at their muscle or also chills or nausea and vomiting, kind of similar symptoms to the actual virus, but they're much more mild typically. So I just want to highlight what we call contraindications, or reasons to not get the COVID-19 vaccine, which would include severe allergic reaction after a prior dose of COVID-19, or being allergic to one of those ingredients in the vaccine. And this is a helpful schematic because it just tells you before, during, and after the vaccine what to do. And just in the interest of time, I'll just continue to go through these slides and let you know that you can review these at your own time if you'd like to take a look at these links or get more information. If you have questions about vaccines, be sure to talk with your provider. And vaccines are provided free to all folks. We know that the science is working because at one point in time, we paused the Johnson & Johnson vaccine to do more research. And so the science around vaccines is working. So folks say, gee whiz, it's amazing that we got vaccines so fast. But the truth is that we've really moved forward with technology in science. And you can see here on this timeline that what we did with creating these vaccines for COVID-19 is that we really started manufacturing and making the vaccines right during the time when we were starting to test them. So we sped up the process only in that we started making the vaccines sooner than we usually would, so that they would be ready, because the COVID-19 is such a severe illness. So this is data just showing that the Pfizer vaccine has been tested on different populations. And I just wanted you to see that it was tested in 43,000 folks there in lots of different countries. And then the Moderna vaccine also had lots of people involved in their studies, as did the Johnson & Johnson. So you can't get COVID-19, you cannot get it from the vaccine. And here's just a reminder about the ingredients lists, if this is helpful for you as a reference, just to be aware of what's in the vaccines in case that is helpful. For me, I don't have a history of anaphylaxis or severe allergy to anything, so I did not have an allergic reaction to my vaccine. And then also, I just want you to know that COVID-19 is safe for women who plan pregnancy, and even safe for women who are pregnant or breastfeeding. And sometimes those people are vulnerable from their immune system. And so we just want to make sure that our moms and our folks who plan to be moms know that it's safe and important to get the vaccine. The Pfizer vaccine is safe for children age 5 and above. And also, we know that the Moderna and Johnson and Johnson are safe for those 18 and above. And we'll stay tuned if we'll find that they're safe for younger people as well. And just so you know, COVID-19 vaccines do not change DNA. And we do think that the vaccines can help us against especially the Delta variant, but maybe even other variants of COVID-19. So as time and science move forward, we're hoping that these vaccines will help to prevent us from getting sick. And we'll stay tuned with the science in case we need to develop more protection and more technology to help us against the spread and illness of COVID-19. So just a reminder to care for ourselves and others by getting a COVID-19 vaccine. A picture of my parents who are in their 70s and fully vaccinated, and my niece Aurelia, who is 3.5. Well, actually, she's going to be 4 in a couple days, and she can't get her vaccine because she's too young. So I want to be vaccinated so I can prevent spreading the disease to her. If you are vaccinated, you still can spread disease, but it's less likely that others will get sick. So the vaccine helps to prevent or decrease the spread of the disease. And I also just want to say that we can protect our other animal brothers and sisters by being vaccinated. This is my doggy Yoda reminding us to get vaccinated because dogs and cats can get coronavirus too. So I'd rather be immune to viruses, and I'd rather be immune to as many viruses as I can be. This is a picture of me getting my COVID-19 vaccine, and this was on the Association of American Indian Physicians Facebook page. I'm a board member for that organization, and that's part of the reason that I was invited to speak with you here today. So Anabasi, Anamasi, Koyana, thank you so much for this opportunity to speak with you. And with that, I'd like to open the floor up to questions.
Thank you very much for your excellent presentation. As you had mentioned, we will start the Q&A portion of the webinar. If anyone does have any questions, please raise your hand so that you can be unmuted. You may also type your questions for our doctor into the chat. Darby will be helping facilitate and monitor the chat for us. And to kick us off, we do have a few questions to get the discussion started. As a reminder, if you would like to speak, please raise your hand so that an NIHB staff member will unmute your microphone. You can also type your questions, as I've mentioned. But the first question I do have on behalf of the National Indian Health Board, I got 3 for you, doctor, if that's okay.
Okay.
The first question is, are the COVID-19 vaccines still effective against the Delta variant, or do they only work for the original strain?
So they are effective against the Delta variant. The Delta variant, even though it is easier to spread and causes worse disease, the vaccines are still effective. They're not as effective as they were against the original COVID-19, but yes, absolutely they are. So some of the data I've seen shows that only like 1 out of 100 people would get symptoms if they're fully vaccinated, whereas with the original outbreaks of the COVID-19, it was more like 1 in a couple thousand or 1 in 5,000 because it was a really, really good vaccine originally. But then the Delta variant got kind of smart and changed and became a little bit of a worse virus. But absolutely, yes, I feel very strongly that the vaccines are shown to be effective even against the Delta variant, especially in preventing hospitalization and severe disease.
Thank you very much. Second question is, why should I get my child vaccinated? Aren't they safe wearing a mask?
So that's a good question. Masks are not 100%. And so what I mean by that is, depending on what kind of mask and how well you're using them, and if you're using masks during eating time, you can't use masks during eating times, right? So if kids are, say, at school and then they're eating together, they could be spreading respiratory droplets during that time. So there's some kind of higher risk times for folks when we're eating or drinking or having our masks off that we could be spreading coronavirus. So kids tend to not get as sick as elders. So I can understand why we're asking that question. Gee whiz, how come we want to get kids vaccinated? But remember that slide I showed that shows that American Indian and Alaska Native kids get sicker than white kids. So I think that it's important to protect us as much as possible from the chance that we could get sick long term or get sick in a serious way. And I do think that masks are important to protect us from spreading and getting the disease, but they're not 100%. And the thing I think is really important about the vaccines is to know that they are much safer than the wild type COVID, natural type COVID infection. So there's so many different things that can happen from the COVID-19, including breathing problems or rashes or chronic COVID or confusion and COVID brain. And it's much less likely that we're going to have those kinds of problems if we get a vaccine. So I do believe it's important for our children to get vaccinated. I especially think it's important for our kids to get vaccinated because they spread COVID real good. So for some reason, kids really are good. Maybe for some reason, the way that their physiology is, the shape, the mucous membranes, the something of how they are makes the COVID spread pretty good in younger kids. And so I think about those multi-generational households, right? So grandma living at home or going to visit grandma or our neighbors and our other loved ones. And so we're protecting our kids, but also protecting our community. And that's super, super important. Hope that's helpful.
Yeah, it is. And I think you kind of touched on the last question I had about the Delta variant and it being more infectious and causing worse symptoms. Uh, I did hear you kind of touch base on that. And I guess, we're talking about the Delta variant. One thing people see in the news is the other variants that are monitored. Um, have you seen any data about any of the other variants coming into Native communities that are on the watch list?
That's a great question. So, and I really appreciate it. I know there are 10 major variants that are listed on the CDC website, and they're all being monitored. But as far as coronavirus being related to cold viruses, and it's kind of like a cousin, and cold viruses change real quick over time. So I know that there could be new variants and different kinds of variants coming out. So we just need to be aware of that in science and in our communities. And that is really a part of the reason we probably should get vaccinated. So I really believe we should be vaccinated because if less people are spreading, less people are getting the vaccines, there's less chance for this virus to switch around its genetic information and have more mutations. So say, for example, in the country of Brazil, where they have lots of people and lots of infections, when they were monitoring, they saw that there were multiple new strains coming out per week. So it's really important that we do surveillance and monitoring. And in our states, we have monitoring programs to make sure that we're looking out for those. And I do think it's important to be aware that if we change the recommendations over time, say in 6 months, we say that we want to try XYZ because there's a new variant, um, we'll have to change together and learn together and be flexible. And I think as Native people, we have lots of experience in working together as communities in being flexible and coming together to do the work that needs to be done to protect each other and to show our love to each other. So I hope that answers your question. I'm not aware that there's any particular variant that we should be concerned of in Indigenous America right now, but we should be in touch with our state and federal monitoring. And I listen to the news and watch out for that kind of news and information on a daily basis.
Thank you very much. I think watching the news, I've learned to tell people, watch multiple news outlets and become informed, be objective to the news, whether it's CNN, Fox, MSNBC, be objective and do your research. And there's a lot of misinformation out there, but there's a lot of truth. And I think events like this and with your presentation, it's helping us combat that and get more facts out there that our people can rely on. So I appreciate everything you're doing and being with us this morning.
Well, I'm happy to be present and honored to join you. So I keep in mind that the World Health Organization, the WHO, is a good resource globally as far as variants go. The Centers for Disease Control is a great reference and resource for information within our nation. And then your individual state public health departments do a really good job of monitoring and getting important information out into our communities.
Yep, you're right. We rely on our local health jurisdiction, our own local health team here at Lummi, and they've kept us safe when the data has been higher in other places. So my hand goes up to all those that are on the front line, preventing the numbers from rising even more. With that being said, we have come to the end of our time. I just wanted to do one more check, see if there was any other questions, Darby. Don't hear any. So I want to thank everyone for joining us, and to all of you who ask things or will submit things. Please don't hesitate to reach out, even if it's after the session. Our contact information is out there. And Darby, I don't know if you could put your email in the chat for everyone in case they need it, but please reach out to her after the session or anytime. It's a good contact to get any information you may want on behalf of your people out there. I'd like to let our participants know that the next session will begin at 12 p.m. Eastern time. During this break, please do some movement, stretches, refill your coffee if you need, or grab a donut. That's what I'm going to do. There's time to go for a quick walk. Even short amount of movement increase our in the moment cognitive functioning and ability to learn. We'll reconvene in a few moments, but please remember that there's a separate Zoom link for the next session. So thank you all, and please enjoy the Youth Summit, be engaged, and keep doing all you're doing to protect your loved ones in your community. Thank you.
Thanks. Take care now.